so much for joining us today at Benefits and Actions Health Benefit Options webinar. My name is Rachel Wise. I'm the manager of marketing, and I'll just be here supporting our speakers, Natascha and Anna. Please introduce yourselves.
Hello, this is Natascha. I'm the manager of complex applications.
Thanks, Natascha and Anna.
Hello, everyone. My name is Anna Marchman Santelis, and I'm the manager of navigation.
Awesome. And Natascha works, kind of oversees our SHIP team, our Medicare SHIP counseling team. She is very well versed in complex Medicaid, usually those programs that support individuals with disabilities. And then Anna also oversees our Colorado Springs area team and our Connect for Health Colorado team as well. So I won't let them downplay their qualifications today. They're really awesome and they know this stuff. So. Thanks so much for joining us today, and we'll just carry on. All right, so Benefits in Action is a nonprofit organization dedicated to connecting our diverse community with the support and resources that they need to thrive. We serve neighbors all across the state of Colorado, thousands of our neighbors every year, and help them to apply, understand, and better utilize a range of food and health related benefits, including the programs we'll talk about today, Medicaid, Connect for Health, and Medicare, but also programs like food assistance through SNAP. Um, Cash assistance programs, utility assistance, as well as Social Security. Actually, that program our Social Security work has just expanded to cover neighbors in all 50 states, so they can call us if they're unable to work and need to apply for SSI or SSDI, or I think even if they just need help filing for retirement. We've also begun accepting Social Security appeals. If someone's recently had their case denied, they can also reach out to us for support there. All of our services are available by telephone wherever you are in Colorado or beyond for Social Security. And you can visit our website at benefitsinaction.org to learn more about those different programs. We have recently added some additional pages to our website that just have a little bit more in-depth information. And there's more to come, so stay tuned for that. So today, Anna and Natascha will share with you about health benefit options for those who are under 65 and able-bodied. And those include programs like Connect for Health Colorado, which is our state's official health insurance marketplace, and Magi Medicaid, that's the modified adjusted gross income Medicaid. And then Natascha will share more about health benefit options for those who are 65 and over or who have disabilities, programs like Medicare and the Medicare Savings programs to help with some of those costs, as well as Medicaid programs for individuals with disabilities. So we'll talk about things like home and community-based services, waivers, and then long-term support as well. All right, without further ado, Anna, please share with us about Connect for Health. Thanks so much.
Yes, thank you, Rachel. My name is Anna again. I am the lead for Connect for Health. To start off, I did want to talk about Connect for Health's mission. So their mission is to increase access and affordability and choice for individuals and small employers purchasing health insurance in Colorado. So, a little history about Connect for Health. So, in 2010, the Affordable Care Act was created to expand healthcare coverage and help lower the cost of health insurance throughout the country. And during this time, Colorado, with Connect for Health Colorado, was already working on building the official state insurance marketplace for Colorado. So in 2011, Connect for Health was established as a nonprofit entity, and then officially in 2013, they opened up the marketplace for health insurance for Colorado residents. So again, Connect for Health Colorado is the Colorado State Marketplace Insurance. And again, with their mission, they do offer financial assistance, and that can be through the premium tax credits and the cost sharing reductions, of course, to lower private health insurance, which includes their monthly premiums and their out-of-pocket maximums. There are tools also to easily compare plan and prices before applying so that you have a better idea of what your monthly premium will be like and what plans are available. And then Connect for Health offers a lot of plans through different insurance carriers like Kaiser, Blue Cross Blue Shield, Elevate, and many more that include essential health benefits. And of course, they offer statewide customer service, which I've used plenty of times, and they honestly are amazing. So they do offer that statewide support. So to enroll in Connect for Health, there is an open enrollment period, which is typically November 1st until January 15th. During this open enrollment period, anyone can enroll for any reason. And if you apply and enroll in a coverage through November 1st until December 15th, your coverage would start January 1st of the following year. So for this year, if you enroll between November 1st and December 15th of 2026, you'll have coverage starting on January 1st of 2027, and anything between December 16th until January 15th, your coverage would start February 1st of 2027. And then outside those dates, so starting January 16th until the end of October, you do have to have a qualifying life event, which is called the special enrollment period. And these qualifying life events include, family additions or changing, could be, having a baby, getting married, getting divorced. Loss of health insurance could be if you lost your employment and no longer have insurance. For whatever reason, you had Medicaid and no longer have access to Medicaid. That would count as a special enrollment. And then moving, if you moved from out of state or moved to a different part of the state, that would qualify as a life event. And of course, changes to income, you can always report any changes as that does affect your financial assistance. So it is important to keep that up to date. And of course, there are other programs available. There is emergency Medicaid, which is those that qualify for Medicaid regardless of their citizenship or immigration status. There's also some reproductive health care programs, maternal health providers for those that are pregnant, and then OmniSalud offers coverage for Colorado residents that don't have documentation. That was
All
a
right.
yeah, sorry.
Go ahead, Anna.
I was just going to say that was a very brief overview. So I understand if there's some questions, I'm happy to answer those if there are any.
Awesome. Yeah, we'll just take a second. I'm checking the Q&A. I'm not seeing any questions yet, but folks, please do know that you can open that Q&A box and add any questions that you might have, and we'll be happy to answer those either during one of these short breaks or at the end of the presentation. So if you have any very specific questions about your own unique case, you might just call us as well, and we'll get you scheduled for an appointment so we can get you to the right program. All right, I'm not seeing any questions yet, so we'll keep going. Thanks for your break, Anna. All right.
Perfect. So the next one is Magi Medicaid, also known as the Modified Adjusted Gross Income Medicaid. This covers insurance through dental, vision. It helps with primary care. It also has the benefit of behavioral health and substance use disorder treatments, and of course, pharmacy coverage as well. So Magi Medicaid depends on your household income. So household is anyone that you file taxes with, not necessarily like a roommate. It's someone that you file taxes with. And they don't look at your resources or expenses, whereas other programs do. Magi Medicaid are those for ages 0 until 64. Once they turn 65, there are other coverage options. And right now, when you apply for Magi Medicaid, you do have to complete a recertification every 12 months. But with recent changes starting in January of next year, the recertifications will be needed every 6 months. And that is when you can update your income, address, phone number. Of course, if those happen in between the 6 months, Benefits in Action can help you update those in your account. But if there are no changes every 6 months, you'll be able to make those changes or at least confirm that nothing has changed. So to be eligible for Magi Medicaid, you do have to be under the 133% of the federal poverty level. Of course, that includes your income and it depends on your income and the number of people in your household. So it can very much change depending on how many people are in the household. Like I mentioned earlier, this is for those that are under the age of 65, as there are different coverages once you turn 65 years old. This program is for citizens, but and qualified legal permanent residents, although there are other factors or other programs under Magi Medicaid that are for non-citizens. For example, the emergency Medicaid, which of course just covers life-threatening emergencies. And even if you don't have Magi Medicaid, there is the opportunity to be eligible for family planning or behavioral health services. And that includes like additional information on family. It can include contraceptives and things like that. Again, that is a very brief overview of Magi Medicaid. So of course, if you have any questions, please let us know.
I'll just pop in really quick. There was a question in the chat about did we have an office? So we do have an office in Lakewood, Colorado, as well as a few co-locations where you can find us. So in order to utilize that, I would recommend calling us directly at 720-221 8354. And we'll give that information again at the end of this presentation as well. There are also, if you visit our website, there are co-locations that we have at various partner organizations around the state where you can find us there for walk-in service. But if you'd like to schedule an appointment, I definitely call us and we actually will complete the application on your behalf once we determine which benefits are the best fit for you. So definitely call us directly if you'd like to apply for benefits, renew those, or if you just have specific questions about your case. And again, that information will be at the end of the presentation as well. But that number is 720-221-8354. Okay, not seeing any more questions right now. All right, we'll keep going. All right, Medicare. Thanks so much, Anna. Passing it to you, Natascha.
All right. Yes, again, my name is Natascha. I am the manager of complex benefit programs, and I am the SHIP State Health Insurance Assistance Program Coordinator for Benefits in Action. Thank you for joining us today. So Medicare is federal health insurance for those who are 65 and over. Also for those under 65 that are on Social Security disability for 24 months, people with end-stage renal disease, ALS, and U.S. citizens or lawfully admitted resident aliens for 5 years or more. Medicare is administered by the Centers for Medicare and Medicaid Services, and enrollment in Medicare is through Social Security or the Railroad Retirement Board. Medicare is an individual choice. So Medicare is for the individual that becomes eligible. A person cannot get Medicare early because their spouse becomes eligible. What works for one person may not be the best for the spouse or the neighbor, and there are no Medicare family policies. So Medicare has different parts. So that's the Medicare alphabet. Medicare Part A is the hospital coverage. So that's hospitals, some skilled nursing, some home health, and hospice. Medicare Part B is the doctor or the medical coverage. Is also for preventive services, some therapies, ambulance, and durable medical equipment. Medicare Part C is the umbrella for the Medicare Advantage plans, like the HMOs, PPOs, those kinds of plans. Medicare Part D is the prescription drug coverage. And Medicare supplements, also known as Medicaps, are plans that you purchase to pay for Medicare copays and out-of-pockets. So generally, when you turn 65 or when you have been on Social Security disability for 24 months, that's when you have to enroll in Medicare. If you miss your initial enrollment, you will have to wait until the general enrollment, which is from January 1st to March 31st, and you may incur penalties that do last for a lifetime unless you are eligible for Medicaid or some other subsidy. You can delay enrollment if you have a qualifying health insurance policy through either work or spouse. And if you have any doubts, you can call Benefits in Action at 720-221-8354 to ask about your enrollment questions, or you can call Social Security. You're probably better off calling us because we're going to be a lot easier to get through. So for this year, the Part B premium, again, the Part B is the medical, is $202.90. There is something called IRMA. So if your income is higher than a specific amount, you pay more for your Part B premium. Original Medicare covers typically 80%. You would be responsible for 20% out of pocket. If you're low income and you have low assets, then you may be eligible for assistance through something like the Medicare savings programs, which can assist pay for that Part B if you are eligible for that program. Medicare savings is also known as Medicaid for those on Medicare. So there's different levels for the Medicare savings, but basically, if you are within, it's kind of like a I can't think of the name now, but they're different levels. So if you're in a specific level, Medicare savings can pay for both your medical Part B or Medicare Part B and your medical costs. If you're above a certain income, up to 1,816 a month, if you're single, it only pays for your Part B premium, but it can also give you the subsidy for your prescriptions. So there is again asset and income limits, and again for single is 9,950. So assets mean if you have savings, stocks, investments, IRAs, 401ks, those all count as assets. The Senior Medicare Patrol, or SMP, helps beneficiaries, families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. So if you do get a bill or a call that you think doesn't sound right, it's suspicious, and you want to report it, you can call the Office of the Inspector General at 800-447-8477, or you can call us, ask for our SHIP, and then we can help you as well.
Okay, questions? So we do have one question in the chat. How much is it now for parts A, B, and D?
So for Part A, there's no premium if you have the work quarters. If you don't have enough work quarters, it can be quite expensive. It can be anywhere around, well, anywhere. It's about 565. I don't have the exact number, but yeah, it's 565 a month for the Part A coverage. But again, if you have work quarters, so it's 40. So that basically means if you worked full time for the past 10 years, you should be able to meet that work quarter quota. For Part B, again, is the $102.90. Part B, Part D depends on which plan you go with. There are plans all the way up to 195, but there are also plans that don't have a premium at all. It just depends which prescription drug plan you choose. If it's a standalone, and on your prescriptions, that's going to dictate how much you will be paying for the plan. But again, that you can have a plan with no premium.
Thanks, Natasha. Yeah, and when you do call us to check into your Medicare, if you are currently enrolled or if you have doctors and prescriptions that you want to make sure you're still covered for you, we definitely recommend having lists of those things ready. So all the prescriptions that you might be taking, because as Natasha mentioned, those plans range in cost. And I think some of that, Natasha can confirm, is affected sometimes by those drug costs or types potentially. Is that right, Natasha, for like different tiers?
Yeah, so if you have a specialty drug or very expensive drugs, usually the plans, you're going to end up with a plan that's going to be charging a little bit more.
Yeah. There is also a program for that that was not mentioned in the Medicare savings slides because it's actually a program, I believe, through Social Security. She'll correct me if I'm wrong. But the low income subsidy for Part D prescription drugs. So based on your income, you may be eligible for what they also refer to as extra help, the LIS or low income subsidy to help with those drug costs with Medicare.
Correct.
Awesome. Thanks, Natasha.
Sure.
All right. Not seeing any more questions, then we'll carry on.
So Medicaid has programs for individuals with disabilities. So there are the long-term services and support waivers. So that would be HCBS or the home and community-based services, long-term care, and the Medicaid buy-in for working adults with disabilities. For the HCBS waiver, if you're over 65 and you need assistance with your activities of daily living, for example, you need help getting dressed, cooking, showering, even if it's just somebody standing outside your door to make sure you don't fall, things like that. That's under the HCBS waiver. It's available for those under 65. You do have to have a disability under Social Security standards. And that the HCBS includes assisted living. So if you need to go to an assisted living facility. Long-term care is specific to a nursing facility or nursing home. And the eligibility is basically the same. You have to be, if you're over 65, or if you're under 65, you have to have a disability under Social Security standards. The Medicaid buy-in for working adults with disabilities. For the working adults, you have to be disabled, again, under Social Security standards. If you're not disabled under Social Security, or if you're not on Social Security disability or SSI, You would have to complete the Medicaid disability form, which is called ARG or the Arbor application. That application has to be approved for that program. You do have to be employed at least 1 hour a month, every month. But employment can mean if you're babysitting for somebody, you're pet sitting, you only get $2, that can count as employment. Usually this program is available for those who are going to be over the income for like HCBS waiver or Magi Medicaid. But again, it's designed for those who have disabilities. And that's available for children. Obviously, the children don't have to work, but it is goes by the parents or the tax household income. So the financial criteria for the HCBS and long-term care, the income is 2,982. That is a hard limit. And the assets, and it's per individual applying. So even if it's a married couple, it's going to look at the individual that is applying for it. So it's the income has to be 2,982 before any deductions. That's the gross amount. And their assets have to be 2,000 and under. And that assets include, again, 401k, IRAs, savings, bonds, any kind of investments, even life insurance that has cash value. There is a asset limit for the spouse. That's 162,000. A home and one vehicle are exempt, so they're not counted as assets. As far as the disability criteria, again, if somebody is applying for the HCBS or long-term services waivers or the disability buy-ins, you do have to be deemed, you have to fit the criteria from Social Security for disability. And if you don't have, if you're not under that, for example, you're applying for the buy-in for working adults, but you're over 65, you have to complete the Medicaid, the Colorado Medicaid disability application. The Arbor, or ARG as we call it, is a contractor that helps Health First Colorado make the disability determination on behalf of the state. Arbor is only responsible for the disability determination of the application, not the actual Medicaid, not the financial and level of care that's from the applications. The application has to be turned in with the Medicaid application to local human services to be processed. It has to go from the county. It can take up to 90 days to process that application. Doesn't mean it will take that long, but it can take. And again, BIA can help you apply for that. There is a fee for those applications, but we can assist with those applications. And again, level of care criteria to qualify for long-term services. So you have to meet 2 of 6 activities of daily living and require at least moderate behavior or memory cognition under supervision. So bathing, dressing, eating, toileting, mobility. And just keep in mind, mental health it is considered under these. There are several different waivers for those who are on the autism, traumatic brain injuries. There's a whole lot of different programs that you may be able to meet the criteria, even if you don't think you might. And again, just call us and then we can help you figure that out. Again, the Medicaid buy-in is for those who are disabled and are over the income or maybe assets for regular Medicaid or for Medicare savings. you can, once you, depending on your income, you may have to pay a monthly premium. It's a sliding fee scale. So depending on your income, after they do certain, um, they take out some, disregard some of your income. That's the premium that you may be paying. So it just depends on your income. And again, it's individual. If you're married, the county is only looking at your income. To be eligible, you need to be 16 or older. Again, employed. Again, the employment, it's 1 hour minimum a month for whatever amount. You have to be disabled under Social Security standards. You have to meet the income is way higher than other Medicaid programs and waivers, but there is still a limit. And you can always complete it online at the Health Colorado website and or call BIA to help you apply for that application. And these are the premiums, and these amounts are after the disregard. So that's what the monthly income and how much you would pay, depending on which income bracket you fit. The buy-in program for children with disabilities allows family of children with a disability who qualify to buy into Health First Colorado for that child. If your child or your family earns too much for Health First Colorado, you may qualify. Again, if the child does qualify, you may pay for a monthly premium, and again, it's based on that sliding fee scale. The child has to be under 19. Again, has to have a qualifying disability under Social Security. The family or the tax household has to be under that 300% poverty level. And again, to apply either under Health First Colorado or through Benefits in Action.
All right. Thanks so much, Natasha and Anna. We really appreciate you sharing all that information today.
Of course.
I will look to see if there are any more questions in the Q&A box. If you have any, please drop them in. But if you just need more individual help and you would like to schedule an appointment for help with your SNAP, your Medicaid, Social Security, or any of these programs we talked today, like the Medicare, Connect for Health as well, please call us directly. Our number is there on the screen. It's the 720-221-8354 number. We'll be happy to get you scheduled with the benefit navigator that best meets your needs, and we can answer your questions or help you apply or renew those benefits. So please do give us a call directly. You can also visit benefitsinaction.org to learn about other events that we'll be hosting. Stay tuned as more information is coming. I think we've got a fall resource fair being planned. We've got some fundraising events, and we'll probably put out some other webinars as well within the next couple months or so. So stay tuned to benefitsinaction.org. You can also sign up there for our Benefits Beacon e-newsletter. You'll just look there at the top of that homepage for the subscribe button, and we'll make sure that we send you that monthly email with any information about programs, other events, deadlines you might need to be aware of. Also, we'll be putting out those recordings from the last couple days of our Social Security Basics webinar and the Health Benefit Update and Changes webinar in regards to HR 1 that has imposed some different age and work requirements on some of those programs that we talked about. So please do reach out to Benefits in Action directly if you have any questions or need help applying, and stay tuned for more information as that becomes available. You'll get a recording of this in your email, and we'll get this shared out as well. So thanks so much for coming and have a great weekend.
Thank you.
Thanks, everybody. All right. Bye-bye.